through compliance with building codes and standards. I propose 2.4 billion for the regulation and development of the construction industry, thus reinforcing safety, quality, and accountability across the sector. Allow me now to turn to the other pillar, that is universal health coverage. Mr. Speaker, universal health coverage, UHC, is central to better's social contract. Equitable access to quality health services is essential for human capital, productivity, and poverty reduction. Towards this end, I have proposed 177.2 billion to the health sector to advance UHC and strengthen essential services. Key allocations include 8.6 billion salaries for UHC staff, 19.1 billion for primary healthcare fund to finance frontline services. Mr. Speaker, to reduce the burden of communicable diseases and advance immunization, I am proposing 18.5 billion for the Global Fund and 6.4 billion for vaccines and immunization program. This investment will protect children and communities and reduce health-related economic shocks. Mr. Speaker, tackling cancer and other chronic illnesses requires focused investment. I propose 3 billion to the emergencies, chronic and critical illness fund, 1 billion for construction of a cancer center at Kisii Level 5 hospital, 300 million to strengthen cancer management in Kenyatta National Hospital, and 150 million for the expansion of comprehensive cancer center at Kenyatta University Teaching Referral and Research Hospital. These measures will expand diagnostic and treatment capacity across the region, given that we are leading as a leading hub in terms of health in this region. Mr. Speaker, to improve tertiary healthcare, I propose 45.3 billion for our referral hospitals. Additional targeted investments will include the following: 470 million for the construction of Kenyatta National Hospital Burns and Pediatric Center, 300 million for renovations and replacement of obsolete equipment at Kenyatta National Hospital, and 2 billion for construction of a new 2,000-bed multi-speciality at Moi Teaching and Referral Hospital to expand capacity and improve health outcomes. Mr. Speaker, to ensure reliable supply chains and strengthen human resources, I am proposing 20.9 billion for Kenya Medical Supplies Agency, KEMSA, 3.1 billion for the Kenya Medical Research Institute, 1.3 billion for the Integrated Reproductive Health Program, 500 million for family planning and reproductive health commodities, and 600 million for equipment at the National Blood Transfusion Services. Mr. Speaker, as a country, we value the services offered by our health workers. To build workforce capacity, I propose 9.3 billion for medical interns, 10.9 billion for the Kenya Medical Training College, and 3.2 billion and 396 million for stipend and medical insurance for community health promoters, respectively. Under digital superhighway and creative economy, Mr. Speaker, digital transformation is a strategic enabler for competitiveness in the fourth industrial revolution. Digital connectivity and literacy are essential for education, healthcare, finance, markets, public services, and emerging digital opportunities. Mr. Speaker, Kenya's creative economy, encompassing film, music, fashion, arts, media, digital content, and design, has become a powerful engine for growth and youth empowerment. Investing in creative industries expands cultural exports and drives innovation. Mr. Speaker, to accelerate digital adoption and inclusion, I propose 8.6 billion Kenya shillings to this sector. And this will include 4.3 billion for Kenya Digital Economy Acceleration Project, 1.3 billion for maintenance and rehabilitation of national optic fiber backbone infrastructure, 528 million for maintenance and rehabilitation of last mile county connectivity, 309 million for government shared services, 382 million for the digital superhighway cybersecurity, 400 million for establishment of digital hubs, and 455 million for ICT infrastructure maintenance. Investing, now let me move to infrastructure. Mr. Speaker, infrastructure is the backbone